Good morning. So nice to have you joining us on a beautiful day here in the Tennessee Valley. A lot of you we know keep your televisions turned to Channel 3, and we are so glad that you do. So if you are a frequent Today Show watcher, perhaps you saw recently a feature about a way to treat depression that seems to be getting an awful lot of benefit. Well, you are lucky this morning because Charles Miller is kicking off the show with us. He's a frequent guest here with his Scenic City Neurotherapy. Good to see you.
Thank you so much for having me.
I'm kind of stumbling my way through here a little bit because I missed the segment on the Today Show, July 7th.
Yeah. It was. It actually surprised me. I didn't know it was coming up. And then a client reached out to me and said, hey, have you seen this? Somebody who had done this with us.
So what this is, whenever you're here, we talk always about the ketamine infusions, and I think that we're going to kind of tie things back in to that as well. But this is called SNT.
Mm-hmm. It's the Stanford Neuromodulation Therapy.
And what this is doing, and I'll let you take it and run, is that rather than if you have depression where you're taking a medication that's kind of masking your symptoms, this is treating the underlying cause, correct?
It's helping to rebuild the neuronal pathways in the brain, but specifically targeting where depression exists in the brain. So we're actually able to optimize communication, not just globally like with what we do with ketamine infusion. Ketamine infusion treats many different things.
Okay.
Mood disorders, chronic pain disorders, even cognitive issues, stroke recovery, but TMS therapy, or transcranial magnetic stimulation, has been around for some time, and this Stanford neuromodulation therapy is an evolution of that, using theta burst stimulation. It's a rapid burst stimulation to give decreased intensity, more frequent treatments in a single day. So we're able to do 10 sessions a day. You're with us all day long. It starts at 8:45 in the morning and finishes at 5:45 in the evening.
Whoa.
Yeah, so the patients stay with us all day long.
Is that tiring? Like, do you feel this?
It's one of these, it's a long day for the patient, but it's not exhausting. The patient can drive themselves. So unlike with ketamine infusion therapy, it's not a medication they're receiving. It's an actual external stimulation that we are using our large TMS setup to provide.
I know that you probably are aware that you use a lot of medical terminology. It just rolls off of your tongue.
Sorry about that.
But that's a good thing. But for the lay people like me, I know education is a big part of what you do. I asked you before the cameras rolled how much of a working relationship you had with medical professionals and mental health professionals in the area. And you said when y'all first started, there was that education component, but now you've got 100+ people sending clients your way, right?
Well, neuroregenerative therapies are not something that is part of psychiatric training before 15 or 20 years ago. So if someone did their psychiatric training before that, they didn't hear about this coming up. And this is unless they've been able to, grasp it from some sort of secondary source.
Right.
They haven't been able to keep up with that. And so I've made efforts, my group has made efforts to make sure that all of our providers in the area know what this is, and more importantly, what it isn't. It's not magic. It's not a replacement for what they do.
Right.
It is a complement to makes what they do work better. It's just one more piece of the puzzle.
Okay, I'm kind of stumbling my way through here, but there are all these thoughts that come into my head at one time. I want to go back to the SNT, the Stanford?
It's Stanford Neuromodulation Therapy.
So let's say that it was me, that I was in your office. Would I be hooked up to something? What
You
is it
would.
like?
It's an actual chair. It looks like a dentist chair. We put you in a position. We actually target using it's what's called stem guide mapping.
Okay.
It allows us to actually target in the brain the dorsolateral prefrontal cortex. It's the area of
Is that here?
It's right up here in the front, and it
Okay.
helps us. It's where we process information. So by increasing stimulation in that area, we are stimulating neuronal regrowth on a large scale, but in a very targeted way where depression lives in the brain. And so it doesn't make the bad things go away. It makes you better at dealing with the difficulties of day to day.
I'm a very analogous person. I have to have a
Me
visual. Okay. When you talk about things being stuck in the brain? Is it like a clogged drain almost?
Yeah, like a pipe that it's like when we were processing a trauma or a period of heightened stress or even prolonged depression, we start to see these areas of the brain that don't communicate as well, these neuronal lesions per se that develop. Lesions is a scary word, but at the end of the day, it's just an area that's not communicating very well or at all. And when these lesions develop in the prefrontal cortex, where we're processing all this stimuli coming in all the time, it helps us. We're able to better process new stimuli, which makes things less overwhelming.
Okay, so last time you and I talked, we used that word lesions. I don't know if it was on the air or off camera. We had a long conversation. So from what I remember, these lesions can grow and grow and grow the more depressed you are, the more trauma you have, right? These lesions
it can be a coping mechanism that your brain actually does. If neurons are firing in the brain rapidly, which like we see with, say, a traumatic event occurs, your brain will be firing rapidly and your brain will shut down these pathways because they're working very hard but not coming to any fruition. They're not being productive, and so it will divert that energy elsewhere and say, we'll come back and turn these on later. When we sleep at night, typically, is when our brain kind of resets and turns these back on. Well, with PTSD, it creates these large lesions in the brain that don't turn back on, and that's, it's mental health is far more physical in nature than we give credit.
Okay, that's where this SNT can kind of come into play, because I think you said after you go through this whole long day, your brain's kind of been exercised in a way that day. So when you go home and you sleep, did you say that there's a protein?
So when we stimulate the brain, essentially irritate the specific area of the brain responds by releasing this protective protein called brain-derived neurotrophic factor. This protein, it is protective while we're awake, but when we sleep at night, actually begins to regrow brain cell connections. Connections between one brain cell and another, which enhances the way our brain communicates.
So the point about the sleep, we hear a lot that if you're not getting appropriate sleep, that's a contributing factor to mental health. So I mean, just the basic need to get a good night's sleep, does that need to be stated a lot?
It can't be overstated. It's sleep. If 2 days without quality sleep, you move into psychosis. It's, reality starts to lose a little bit of its meaning. You start to disconnect. It's very hard to have good mental health when your sleep is interrupted or poor.
So I know that you did not see the episode on the Today Show July 7th, neither did I, but the person who called in to tell you about it, was the segment talking about like proven benefits of this SNT?
The SNT, Stanford developed this because TMS therapy, the classic transcranial magnetic stimulation, is very slow. It's 1 session a day for 6 weeks, and then usually 3 weeks a wean off, 36 total sessions. What SNT allowed us to do was take that whole process and move it from a 6 to 9 week process into an aggressive 5 consecutive day process, 10 sessions a day, 5 consecutive days. Now it does require the patient spend the whole day with us, and they're the only ones that get to use our TMS machine that entire week. It's because that whole piece of our practice is devoted to them.
How common is a practice like yours? I mean, are people catching on to this all over the place?
There are a lot of people that are starting to see this, a lot of other providers out there that are starting to see the benefit, and we're all over the country. You're seeing them pop up. Now there are different standards of practice. Each practice is kind of, and every medical practice runs to the standard of the provider that is directing it. But making sure that that this is done ethically and to the highest standard, that that your provider is showing you the literature behind why they do what they do. They need to have reasons for why they do what they do.
Right.
That's important.
Charles and I talk in these somewhat generalities, but he said earlier how this SNT targets directly to a specific area of your brain. The you can't be overstated either. When people come in and they talk to you, they're there for a long time initially because you want to really know them, right?
Well, we want to know them and we want them to know us. Education is a huge component to our process. If you don't know what you're getting into and we don't have adequate expectations, it's hard for the patient to judge success. If you're coming in and looking for one thing but then find another, you may not realize that you're moving in the direction we want you to go if we don't teach you what that is.
Right. I think it's a very fascinating conversation, and I have a feeling there are folks watching today who are thinking, I've got to call my friend, or I need to let my child's teacher know about this, because people don't have a way of knowing what you're doing if you weren't coming out here talking. So thank you for your time.
Oh, I'm happy to be here.
It's Scenic City Neurotherapy. Their offices are right there on Shallowford Road. The phone number is 228-0579. Online at sceniccityneuroTherapy.com. If you're currently working with somebody in the mental health profession and you want to mention this to them, there's a good chance they already know about the work that Charles is doing. If you are not yet and they come to you first, you'll also help them find somebody, right?
Absolutely, absolutely. Everybody, you know, the follow-up component with a counselor is imperative.
Okay, great to see you.
Absolutely glad to be here.